In this video, I will discuss melatonin dosages. The general dosage range for melatonin is from 0.5 to 5 milligrams. It is best to start with a lower dosage and then increase if necessary. Unlike prescription sleep medication, melatonin does not lose its effectiveness over time. Here is what one study had to say on the subject. The effects of melatonin supplementation after 3 months show no change from its effects after 1 week of use. Again, this is in contrast to other sleep medications which require increasingly higher dosages. Once you find your ideal melatonin dosage, just stick with it. I have been using the same melatonin dosages for over 3 years and they continue to work just as well. I advise against using any sort of slow release forms because they take longer to clear your system and tend to make you groggy in the morning. In the case of melatonin, more is not necessarily better. This is because dosages in the 1 mg to 5 mg range produce blood levels that are higher than the normal peaks. The ideal dosage for most people is 3 mg. You can use higher dosages, such as 9 mg, if you want to make a rapid change. For example, if you are used to going to bed at 2 or 3 in the morning and you would like to be asleep at 11 o'clock, then take 9 mg at 10 o'clock. The thing is, if you are relatively rested, you may find yourself naturally waking up at 5 or 6 in the morning. But if you are sleep deprived, you will likely sleep around 9 hours and wake up extremely rested. Even with melatonin supplementation, it is important to sleep in total darkness. This is because your body starts to lower blood levels of melatonin whenever blue wave light hits your eyes. Let's talk about when and how to take melatonin. Take melatonin 1 hour before you want to be asleep. You can take melatonin with or without food, but it is better with food because it somewhat slows the release. Melatonin absorption is aided by taking it with a meal that has fats. Also, melatonin is naturally produced by the gastrointestinal tract following a big meal. So using melatonin with food is more in tune with natural release. Melatonin dosages should be adjusted based on your reaction to it. I tend to use higher dosages because of lower natural production, but others do very well with dosages as low as 0.1 milligrams. Please remember that if you take melatonin during the day without covering your eyes, it will not help you fall asleep. It will just make you drowsy. Conversely, if you want to eliminate melatonin-induced grogginess, then exposure to a strong source of light will rapidly lower melatonin levels and eliminate the grogginess. Just 15 minutes does the trick. In this video, we have discussed melatonin dosages and a few tips on how to use it to get the most out of it. Melatonin is a part of my essential nutritional supplement stack. If you want to see which are the products I personally use, then go to damianalexander.com/melatonin. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourownbatteries.com.